Thank you for joining our One Learning Series webinar today for August 2022. Today we are going to be reviewing Magi versus non-Magi medical programs. Just as a review, we've done this topic in the past, but we have new community partner assisters who have joined us since then, and it continues to be a topic that people have questions about. So we wanted to offer a review. And we have lots of time for question and answer. So today's session is scheduled to go until 10:15. We made our IE webinars or our One Learning Series webinars a little bit longer so that we can have that very interactive question and answer session at the end, which we will also be recording. We have some folks with us today that are our subject matter experts who can help us and help us answer those questions and help make sure that the content is being clarified along the way. So thank you to David and Christy and Janelle and Jessica for being here with me today. And I'm going to launch in and you'll hear from all of them as we go. I'm Deanna Simon. I'm with the Community Partner Outreach Program, and we expect to hear lots of questions from you today. Right. So first, a little broad picture overview, just to make sure we're all on the same page here. Oregon Health Plan is Oregon's Medicaid and Children's Health Insurance Program. It covers medical benefits for Oregonians at no cost to them, and those medical benefits include physical health, behavioral health, dental health, and some vision care. They also may include long-term services and help paying for Medicare costs. Something that's important to know is that enrollment is always open for OHP. We might hear about open enrollment. Those are for other private health plans, but Oregon Health Plan can be applied for any day of the year. And we now have an integrated system all-in-one online, and there are more than 40 different types of medical assistance available in this one system, the Oregon Eligibility System, that hopefully all of you are using and you have experience with. So the good news is that for all of the medical programs these days, you can apply for all of them in the one system. And understanding some of those medical programs can be helpful to a community partner assister and an application assister so that you can understand the ways it works, so you can understand your different eligibility determinations, because each person is evaluated separately and different programs have different eligibility criteria. So different individuals in a household may end up with different programs, or some may be eligible and some may not be eligible. So everything that we're talking about today are not things you need to know to help people apply, but many of you find it useful to understand our programs so you know a little bit of what to expect and you can understand the results. So for today's purposes, we're going to separate these many medical programs into two categories: Magi medical and non-Magi medical. So at the core, Magi stands for Modified Adjusted Gross Income. And really, that's just our way of counting income. What income rules do we use for these programs? And all of our programs will fall under one of these two categories. So Magi Medical is that standard OHP that some of you used to help people apply for before we had an integrated system. It's generally for people under 65 and who are not on Medicare. Or it's also for people who are 65 or over or disabled, but they're also caring for a relative who is a minor. Now that program for those 65 plus or disabled individuals who are a caretaker of a minor child has a lower income limit. And that, the programs have different eligibility criteria. But that Magi Medical is who those folks are, what those folks are eligible for. The non-Magi Medical is a different program. It is for people who are 65 or disabled or blind, 65 or over, or disabled or blind, or folks with Medicare. So these are some of the two distinctions in terms of who is eligible for what. Now there's some folks who span the two categories. Adults may be eligible for Magi or non-Magi, depending on their age and their disability status or their Medicare status. Same with children. They can be eligible for either. Both programs have extended pregnancy benefits for pregnant individuals. And they both have emergency care. So CALM, that many of you have heard of, people can get CALM either under the Magi part of the umbrella or under the non-Magi. So even somebody who is 65 or over can still get that emergency level Medicaid. Same with long-term care. Somebody who needs those long-term care services because they need help with their daily activities of living, if they need that, they can get it whether they're under 65 and not on Medicare, or over 65 or disabled or blind or on Medicare. So hopefully that is one way to think about things. I'll show you the next slide and then we'll take some questions. Another way to think about this is that Magi Medical is full OHP benefits for those folks, or depending on their immigration status, or if they have if they're not a citizen and have certain immigration statuses, they can get CALM Plus if they're pregnant. So full OHP benefits, CALM Plus, those are the full benefits. You can also get emergency benefits under Magi Medical and long-term care. On the other side, the non-Magi, which is a different set of criteria, you can also get full OHP benefits or the CALM Plus for pregnancy. You can get emergency benefits. You can also get long-term care. And there's an extra one that you can get under the non-Magi Medical for people with Medicare, which is called the Medicare Savings Program, and that is help paying for Medicare costs. So there are a lot of similarities under Magi and non-Magi in terms of what benefits you can get. Just depends on who you are, your age, your disability status, and whether or not you have Medicare. And they will have different eligibility criteria. We're not going to go into those eligibility criteria, but we'll touch on some of the big pieces. So I want to pause there and see what questions we might have. David, do you want to tease out any questions that are relevant right now?
Sorry, searching for the mute. I don't know that we have any. Jessica's been kind of answering a few, but most of it's just regular audio stuff.
Okay, great. All right, something I wanted to touch on is Medicare savings programs. And this is going to be a pretty basic, quick overview. The idea for today is that we open it up for lots and lots of questions so that we are catering our discussion to what all of you want to know, because we have offered this before and it is available as a recording, and some of you know this quite well. So mostly it's about questions today. So just know that's why it might feel a little bit fast. Medicare Savings Programs is a Medicaid program that helps people pay for their Medicare costs, for those Medicare premiums, copays, and deductibles. It is not it's not benefits at all. It is help paying for something. So you can think of it as financial assistance. It can be paired with OHP benefits, so people can get help paying for Medicare and potentially also get OHP, medical coverage. It does use the federal poverty level for income eligibility. We really want to mention this because we still find that many people don't know about the Medicare Savings Program and that they can get help paying for Medicare. So they're paying those out-of-pocket costs for Medicare when they could actually get help with them. So we want to make sure that you as community partners are looking for people who have Medicare and make sure they are applying in the one system to see if they're eligible for help paying for that Medicare. All right, let's see if we have any questions right now.
We have one question that is asking about the difference between OSIP M and MSPs as far as which is a full benefit versus supplemental?
Yep, hang tight and maybe we'll answer that in the next slide, or the next couple slides. So this MAGI and non-MAGI, modified adjusted gross income. It is a way of measuring income, and under MAGI, we call it Oregon Health Plan or OHP Plus. When you get that same benefit package, the full benefits, but you get them under the non-MAGI program because you're 65 plus or you're disabled or you're on Medicare, we call it something else. We call it OSIP-M. So OHP and OSIP-M are the same benefit package, but they're based on different eligibility criteria. Medicare Savings Program, Help Paying for Medicare, is also a non-MAGI medical program, but it is not full benefits. It's just financial assistance. But because it falls into the non-MAGI program, we have some notes about the eligibility for it. So MAGI medical programs are based on federal poverty limit, or a percentage of the federal poverty limit. And it's based on monthly or yearly income only. It does not count resources. So it only looks at income, not resources, if you're in that under 65 or without Medicare piece. It does have higher income limits for children and for individuals who are pregnant. And it does not require an interview to ask about your resources or your assets. So these are some of the ways that MAGI and non-MAGI are different. If somebody is 65 plus or on Medicare, then they will be in the non-MAGI category for the most part. And those programs have various income requirements. Some are based on percentage of federal poverty level, but some are based on the SSI standard. That's the Supplemental Security Income. So it just depends on the program. It's a little more complex over there in the non-MAGI world. A big difference is that there are resource limits that typically apply. So how much you have in your savings, or how much a second home or a second car might be worth, or an annuity or some life insurance might count. Those resource limits will count toward your eligibility. The household size varies between programs in the non-MAGI medical programs. It's a little more complex than for MAGI. So just know that the household size can be different depending on what program you might be eligible for. So what you think you know might not always apply. And those non-MAGI medical programs often require an interview, and that is a telephone or in-person interview with an eligibility worker to review the different parts of your application, including those resources. And there's an extra form associated with that that gives the agency permission to do a resource check on you. I would like to pause there and see if there are any questions. And if that answered the question about MSPs versus OSIP-M. Janelle, we have a question here about the SSI standard amounts. What is the SSI standard amount? Is that an easy answer or to chime in about, or do we need to set aside more time for that later at the end?
Yeah, it's relatively easy. I think we were working on putting it in writing in the chat, but the SSI amount is $841 per month for an individual and $1,261 for a married couple.
Great, thank you. I also see here, so OSIP-M, which is full OHP benefits for non-MAGI eligible folks. Those full OSIP-M benefits can be available to people without Medicare. So somebody who's 65 plus and does not have Medicare might be eligible for that OSIP-M. Or if people have Medicare, they might also be eligible for that OSIP-M, for that full OHP benefit, And that's what we call a dual eligible. So when you hear the term dual eligible, that is often what we refer to, somebody with both Medicare and that Medicaid. And if they have Medicare, the Medicaid is probably going to be that OSIP-M Medicaid. So hopefully that explains that. And I don't see any more questions, so I'm going to move on.
Oh,
Oh,
we have one, which is, I think, really teasing apart the difference between OSIP-M and MSPs for people who have Medicare, because it is possible to have Medicare and be on one or both of those Medicaid programs. Is that correct?
Yes. So for Magi, if you have Medicare, you cannot receive Magi. Non-Magi is different in that you can receive OSIP-M and Medicare, and be eligible for OSIP-M as well as a Medicare savings program to help pay for that Medicare.
and just to make sure people are getting it, when we say OSIP-M, that's full OHP benefits. It's just for a different group of people with different eligibility criteria. But OSIP-M and OHP Plus are the same benefit package. And I know I already said that, but I feel like it can be confusing, so I'm saying it again. And I see a great question here. Is QMB and MSP the same thing? Yes. So Medicare savings programs have different levels of assistance you can get, and one of them is QMB. We do have a whole module on Medicare savings programs and diving down into the different levels of assistance. But QMB and SMF, and Janelle, what are the three that are all part of the Medicare savings programs, the three levels?
They are QMB, SMB, and SMF.
Thank you. And we're not going to go into those details. Those are just the levels of financial assistance that you can get, essentially. I'm oversimplifying, but basically different levels of assistance you can get to help pay your Medicare costs.
I see a question about how OSIP-M works if the client has Medicare. Just a quick high level is that Medicare will be billed first and pay whatever they can pay, and then OSIP-M Medicaid will be billed last. I think that's what the question was.
Thank you. I also have a question here, which is what changes the program from OHP to OSIP-M? It will depend on whether you're under 65 and without Medicare, or over 65 or have Medicare. So if somebody is on Magi OHP and they're 64 years old and they turn 65, they will then switch programs. They will be evaluated for the OSIP-M program because their age has changed into the age range for that non-Magi OHP. I hope that helps.
Yeah, and I think that that's a little bit of the kind of confusion in the way we use our wording, because OSIP-M is OHP, but generally OHP has been used as a term for Magi
That's
only.
right.
So it's a little confusing.
So we are trying to move a little bit, and we're definitely imperfect about it, but we try to refer to Magi OHP when we're talking about that program for 65 and for under 65 and without Medicare that has that does not look at resources, to distinguish that that's different than the non-Magi OSIP-M, which is basically the non-Magi OHP that does look at resources and has various income limits. So hope we didn't just confuse people more, but I'm going to go on to the next piece right now. And so this is what we've really been talking about. Non-Magi medical programs, the most common ones are is OSIP-M, which is Oregon Supplemental Income Program Medical. OSIP-M is full OHP benefits, but with different eligibility factors and for different age categories and Medicare status. And Medicare savings programs help pay for the Medicare costs, but they are not coverage. So just repeating what we were already talking about. A little note about long-term care services. Long-term care services can be available to people on MAGI OHP or that non-MAGI OSIP-M. And they are there. They are a higher level of service for people who can no longer meet their own daily needs or their ADL, activities of daily living. We have a whole webinar on long-term care. I've put a link here. I encourage you to listen to it if you'd like to know more. This is a very brief overview. Applicants must actually apply for long-term care services and participate in a needs assessment. So there are questions in the one system that must be answered yes, and it is about does a person need assistance with their daily activities of living, and would they like to apply for assistance with those? Both of those questions must be answered yes, and then they will be evaluated for the long-term care program, and they will need to go through the regular application process for OHP or for Medicaid, and then an additional physical needs assessment. Again, people can get long-term care whether they're on MAGI OHP or that non-MAGI OSIP-M. And a special note here, we've gotten this question a lot. Long-term care services are available to those who are newly eligible for full benefits under the Healthier Oregon program, or for the Healthier Oregon members. Long-term care is not available to people who are on COWM or COWM Plus. And now I will pause because I'm guessing we have some questions in the question box. Oh, I actually don't see any.
We're currently working on some answers.
Okay.
I'm curious if anyone has any questions about long-term care while we're working on those other answers on the previous topic.
Feel free to type them in. We just have a couple more slides, and then we are really just opening it up for questions and answers, whatever occurs to you. You know, the MAGI and non-MAGI covers all of our medical programs, so this is really anything goes in terms of questions. This is something people have been asking for, is a forum to ask a lot of questions. So hopefully this review reminds you of what you want to ask, and we are here to try to bring you answers or flag it for a follow-up. So in terms of what you need to know as a certified assister in order to help people, is that all of the programs, all these medical programs are in the one system. So whenever you help people apply, you're helping people apply for all of them. And our one system, whether it's the worker portal because you submitted a paper application because you couldn't use the applicant portal, or you've entered this into the applicant portal, once that application information ends up in our online system called ONE, or Oregon Eligibility, our ONE system will dynamically ask questions it needs based on the person's parameters to determine the eligibility for all of the programs that are relevant to that person. So if somebody is under 65 and not on Medicare, it's not going to ask questions about resources. But if they are over 65 or on Medicare, then it will ask questions about resources. So that's why you may see different questions for different applicants. And those applicants might have different next steps after submitting the application. We've also been working on updating our notices to make it clear who needs to do what. So in the end, once you answer all the questions in the application, ONE will evaluate for all of the programs, but it will evaluate first for the highest level of benefit. So first it will evaluate for basically the non-MAGI OHP because we don't look at resources. And it will provide those benefits if somebody's eligible. But if they're not eligible for that non-MAGI OHP, then it will move on. I'm sorry, for the MAGI OHP, it will move on to the other programs. So you don't really have to know eligibility at all. The ONE system takes care of all of it for you. and it tries to give the highest benefit to folks first before evaluating for the next level. So that is your really, really quick overview of Magi versus non-Magi. And we would like to open it up for any questions you have and anything you're grappling with.
I can start us off by going through a couple of questions we were able to answer in the chat, just so we
Great.
can say them out loud as well.
Perfect.
I see one question specifically about people who are lawful permanent residents, people with a green card, if they can be eligible for OSIP-M or not. And the answer is that the OSIP-M programs have the same non-citizen rules as the Magi side. So the 5-year bar will apply to a lawful permanent resident, but there are also CALM programs built into OSIP-M. So they should look pretty familiar to the folks who are used to talking about the other side of OHP when it comes to helping people who are non-citizens. And then also, if the subject matter experts have questions that they want to talk more about, I would welcome you to do so.
I'm looking through the questions as well.
There's a lot of great questions.
Mm-hmm.
There are some questions about, like there was a question about the interview and whether they will just get a notice or if there will be an attempt to call. And the answer is that there will be both. So the system, when it sees that an interview is needed, it will send out a notice stating so and giving the person a special number to call to get the interview completed. But also, when a worker receives that application in their queue and starts to work it, they are supposed to be making 2 attempts to call that person and either do the interview or set up an appointment for the interview. So both.
I'd like to add to that, Janelle, if I may. That interview, there will also be a notice requesting that interview. And that notice will populate in each client's dashboard. And it will show in each community partner's inbox in the one system. In theory, hopefully, I don't know exactly what the subject line will be of that notice, but if you're watching your inbox, you will likely see a notice that looks like it has some sort of action associated with it. That's a good place to watch for those notices coming in if you'd like to then follow up and help that individual complete their interview. You can also find it in their individual case in your applicant portal. So just a way for community partners to further assist the folks who are applying. Janelle, did you want to ask and add anything to that?
No.
Okay.
Just trying to scroll through and read all the questions. There was one about long-term care assessments and how long it takes to get them done, and that one is a big it depends. It depends on a lot of factors between how busy the specific office that is going to be doing that assessment is and how far out they have to look at for the appointments, if they can get a hold of the applicant or not, and so they got to coordinate the applicant's schedule. It is really hard to say how long it will take. Some offices are not as busy, so they're super on top of them and can get them done within just a few days. Others, it can take, more like 2 weeks to get the appointment completed. So yeah, that one's a hard one to answer.
Thank you. Let's see. I'm trying to fish through these also. So Jessica, if you see any questions that you'd like to call out for group discussion. I do see a question here that I'm guessing more than one person has. which is what are the two one system questions where you have to answer yes in order to have somebody be requesting long-term care services. And the questions are, do you need help with your activities of daily living? And do you want to apply for assistance with those? We do have screenshots of that in our long-term care webinar that is linked on the slide, but I didn't put them into this overview. But you're welcome to refer to that and find that screenshot, and those are the two questions. You can, if those are not marked yes, then the person will not be evaluated for long-term care services, and they will not get a request for that assessment.
I am seeing quite a few questions about interviews right now. And I do want to start by pointing us towards, we do have an interview guide that is on group site that we made in, I want to say November of 2020. And I recently checked in with our APD staff and they verified that other than a few points that are talking about IE rollout, because that's how long ago we made that guide. The information there is still accurate and the phone number on that guide can be used. So there are some resources that we can help people connect successfully to a eligibility worker, but there are also, there's a lot of work happening right now and there is a backlog on some of these activities. And I will let you take over before I say more.
Janelle, did you want to add anything there, or should we move on to the next question?
I don't think I need to add anything just yet. Sorry, trying to scroll through and see what other questions are specifically about interviews. There's a lot of different questions and a lot of different areas in here. If there's any specific ones you guys see about interviews you want me to answer, otherwise, I think I'm going to go in order because it's hard to go
I
back
agree
and forth.
with going in order. Yep.
Okay. Let's see. The next one I was looking at was a question about someone electing not to enroll in Medicare Part B when they're eligible. Will they be eligible for either MAGI or non-MAGI program at all? So that is actually brings up a good point about a change that we have recently made in the requirement to pursue Medicare. So you're correct that previously that was a requirement, but we've received federal guidance that that is no longer so. So if a person is eligible for Part B but has not enrolled, it will not make them ineligible for non-MAGI medical anymore, or MAGI, I believe. So yes, they will be able to be eligible if they meet all the other requirements.
Thank you. I'm just typing that answer in here so we can also have a record of it, that we have recently made a change and that we're not currently requiring someone to pursue Medicare in order to be eligible for Medicaid.
Correct. Yep.
Thank you, Janelle.
Next is a question about the difference between MAGI, non-MAGI, and Healthy Oregon. So I think the question is, so for Healthier Oregon, those, gosh, how do I explain? So if a person meets the Healthier Oregon eligibility based on their age bracket, they would be eligible for either a non-MAGI or MAGI program. So those, the eligibility for both of those programs doesn't change. What Healthier Oregon does is makes it so they meet the citizenship, non-citizen requirements to receive the full package rather than emergency benefits.
Yeah, and that is a consistent source of confusion, Janelle. So
yeah,
I'm glad somebody asked it. And yeah, there really is no difference. Healthier Oregon is not a different benefit package. It's just an expanded set of eligibility criteria is a way to look at it. It makes more non-citizens eligible for our existing benefits.
Exactly.
I hope that answers your question, but if not, please keep asking.
I have seen some questions / comments about how OSIPM with limited drug is a slightly different experience for people versus the full OHP benefit. I don't have the expertise to talk more about that, but I did want to call out that I see that in the chat too.
Yeah, I'm not sure on that one either.
I took
OSIPM
a
with limited
stab.
drug.
If it's okay, I'm doing some checking and I'm taking a stab at those. The crux of the issue with limited drug is if people have Medicare and are eligible for Part D, whether or not they have signed up for it, their OHP will only cover on a limited basis. It's not, they're not going to get full coverage if they don't have Part D yet. So it gets a little tricky with prescriptions and Part D. But let me know if there's more questions about that.
You might have opened up Pandora's box there, Christy.
Right. I didn't mean to.
That's okay. That's kind of what today is about. And we know that we don't have to be able to answer every single question, but hearing what the needs are in terms of having information is very helpful, and we can get back to you. When you type in a question into the questions box, we can see who typed it in, and that is a way for us to follow up as well. Are we punting all interview questions and for a little bit, Janelle? But I think here's one that I would like to answer if possible, because it does come up. Can a community partner help a client schedule an interview?
So in a way, yes. So the community partner cannot do the interview on their behalf. I don't believe they can actually schedule it. I mean, the only way they can help is if they want to call with the person or something of it. They can't do it on their behalf. So there are quite a few questions in here about giving the person the interview line number, and that's absolutely okay. I mean, they should be receiving that notice themselves as well, but they can give the interview line number, and it's fine to call that before the worker tries to call, because I know that quite often people see a weird number and they're not going to answer it, and it might be ODHS calling for that. There was also a comment in here about that number isn't necessarily any faster than the assister line, and suggesting that they call the assister line instead, and I'm not 100% sure how that would work.
I think Jessica was just looking into that. She may be able to speak to that.
Okay.
I was typing in a different thing. Can you repeat that?
It's okay. We were just discussing this morning, Jessica. When somebody calls that special interview phone number that's on the non-Magi interview guide, these days it routes over to the eligibility workers. So it really isn't different than just calling the eligibility line. That's my understanding.
Yeah, and I do see that at least one of our community partners has experienced it being a faster process to go via the CP line with the client there with you than using any of the public-facing lines. So,
Hey, can I offer
yeah.
maybe a little bit of maybe transitional context about where we're at with some of the call center work too? And for those folks who don't know, I'm helping stand up an auxiliary customer service center to work in partnership with ODHS to help with the call volumes. And right now we have about 40 or 50 people who are somewhere in between answering the calls and coming out of training. And a lot of those like scheduling kind of calls, those appointment calls, are going to be headed back to this new support staff team in the next like 4 or 5 weeks. So that should kind of help rebalance some of that. But it is true right now, as we've been trying to make the transition, we've had to have help from the eligibility staff, so it's been a little jumbled. So I would say a little bit of grace and patience for 4 or 5 weeks, that may iron out a little bit.
Thank you, David. All right, I'm going to see what other questions we have here.
I'm seeing quite a few that need a little additional clarification on the pursuit of Medicare. Yes, we are saying that if they do not need to apply for Medicare at all prior to applying for Medicaid. It is no longer a requirement to do that. Then the follow-up on that is a question we've gotten quite a bit is, can a person choose to disenroll from Medicare and only have Medicaid? That's fully allowable. The state's not going to stop them. We're not going to recommend it, or I mean, we don't give recommendations really on anything, just the information. The one question that has come up from staff that they're concerned about with people disenrolling is that Medicare enrollment is once a year. And if for some reason they lose their Medicaid at any point during the year, they have to wait and have zero coverage until the new Medicare enrollment. So that's just some information to be able to give to clients and help them to make the decision whether they want to keep the Medicare or not.
That's great. Thank you. That's really helpful to know. At risk of jumping around, I see a question that I want to make sure we're getting to, which is what are the requirements for long-term care assessment? So jumping from the Medicare question over to the long-term care, maybe I can summarize, Janelle, and then you can fill in anything.
Sure.
The long-term care assessment looks at different types of needs, and there are higher level needs and lower level needs. And depending on the combination of needs that people have, they might become eligible for just a little bit of in-home care per week, a lot of in-home care per week, or if they have a high need, then they might be eligible for that higher level of care in a facility. So it really depends on what their needs are. And then there are different levels of care that they might be eligible for based on those needs. And there's a whole assessment and a whole scale and all these points that we won't get into, but that's the basics of it without getting too technical. Janelle, do you want to add anything to that?
Maybe just some examples of what those needs may be, but yes, you're right. That's way too technical to get into, but some of the things that people need in long-term care are assistance with getting in and out of bed, bathing, eating, walking, any of those type of things, as well as some of the less hands-on stuff like medication, managing their medication, or household chores type of thing. So those are just some of the examples of things that they may need.
Great. And for the person who asked that, if you have more questions, please type them in and we'll see what we can get to. Right, I think we're all reading the questions and trying to figure out which ones we should answer next.
I do want to point out one thing about our OHP, our medical application, is that there are questions to sort of tease apart if people think they might be eligible for things like Social Security, Supplemental Security Income, and Medicare. And that question about, like, what do people currently have versus what should they technically be eligible for? The application is made in a way that should help start to point our workers and members in the right direction, but there are a lot of programs where that you have to pursue what you are eligible for. And so just as a broad thought beyond the nitty-gritty, there are definitely many times where people may have to then also apply to programs outside of our systems that we don't have control of. And so we don't have a lot of materials and training on those. But there are staff who can help people. And I even see some of our community partners chiming in with ways they have helped people or they know about programs outside of the ones we're talking about today.
Thank you, Jessica.
So I am seeing more follow-up questions on the pursuit of Medicare. So someone did clarify that in certain instances, they can enroll in Medicare outside of the open enrollment. And that's true. There's always exceptions to the rule. I just don't know all of those instances. But the other piece is some of them just making sure that they have it correct, that the client can choose not to enroll in Medicare and choose to try and enroll in Medicaid. Again, yes, at any point in time, even if they lose Medicaid, they can reapply and continue to not receive Medicare. The one system, you're going to answer, so there's a couple of questions about Medicare in the one system. It will ask if someone has it or if they are eligible for it. You do want to answer that they are eligible for it, even if they're not enrolled. But we are working on changes where they will not, or the one system, I don't think it currently does, pen for pursuit of Medicare. So it does not pen them if they're eligible for it but don't have it. Also, it automatically checks Social Security Administration. So should they lose the Medicare through disenrollment or whatever reason, or if they gain Medicare, that the system will automatically see that, and it will start looking at a person for Medicare savings programs if it receives information that they have Medicare from Social Security.
Thank you. Janelle, I see another question here. If somebody with Medicare needs long-term care services, can they apply for and potentially receive long-term care services through non-Magi, as well as having Medicare? And does that happen to the one system?
Yes, because long-term care services, you must be eligible for OHP plus benefit, so either Magi or non-Magi OSIP-M. And obviously with Medicare, unless it's like PCR or certain specific instances, they would be non-Magi, so they get OSIP-M as well as the Medicare Savings Program, and they could receive the long-term care services.
Thank you. All right, we do have some really like kind of work-specific questions in here that we're not stating out loud just because they're a bit too specific to people's individual situations. So just I want to acknowledge that if you're not getting your question answered, that doesn't mean we don't want to answer it. We're just going to wait and follow up with you. Let's see. I think is that all we have right now? That's all I'm seeing at the moment. I will continue to scroll through. If we did not answer your question, you think we may have missed it, can you please retype it in? Because there are a lot of questions here, so it's hard to see them all. Yeah. Okay. Oh, there was a question, Janelle, on what is the highest income under which somebody can be eligible for the Medicare savings programs. Do you have that off the top of your head?
I do. So each of those levels we were talking about, the QMB, SMB, and SMF, have different income limits. And if you're talking about for like a single individual, the QMB has the lower limit, SMB has a higher limit, and SMF has the highest limit of all, but also a little caveat to SMF is you cannot be receiving OHP plus benefits and SMF. So anyways, to answer that question, for a single individual, the highest income they could receive is $1,529 per month for that SMF benefit that pays the premium only. Those limits also go up depending on the number of people in the household that are counted, and that gets very complicated on who is and who is not included.
Right. And so I'd say it's the same as Magi conceptually, which is there are different income limits that might be associated with different programs, and those income limits change based on the number of people in the household. And that household, who is in the household, can get a little complex. So I think ultimately what we really want to make sure is that nobody gets screened out. You should never ever say, oh, you're probably over income for Medicare savings programs. I don't think you should apply for that. In fact, never tell somebody. My guidance would be, don't tell anybody that they're over income, because we have lots of deductions that we apply to that equation, and there may be pieces that this person isn't thinking to tell you about, or factors they're not mentioning. So people should always apply, because you might end up with something you don't expect, because we're not eligibility workers, and there are so many questions to determine that eligibility. So please avoid, I definitely don't, I hope we don't hear about a situation where somebody says, well, I make $5,000 a month, and somebody says, well, you're going to be over eligible for OHP, so let's look at your other options, right? That shouldn't happen. That's not our call. So always have somebody apply, because you never know. So even though
That's a really good point.
Yeah, we might supply these income limits, and the reason we supply them is so that when somebody applies and they get an eligibility determination, it can help you understand it. Or if they do apply and then they're denied, you might have a sense of why. And sometimes there's something incorrect in the application. A question got missed, and you might end up with somebody getting a denial, and you think to yourself, that doesn't sound right. I'm going to question that. And we've definitely caught a number of mistakes and gotten people benefits because there was a mistake on the application. So that's another reason why we share those income limits. But everybody should apply if they're interested in benefits, and we have to let the system determine that eligibility. And that's a really important thing to keep in mind to protect yourself and to protect us as an agency. We never want to screen people out. I'm sorry if I talked too much about that, but it's very.
No, it was a soapbox I was about to climb up on myself.
Yep. Somebody has a question here about our change in our requirement to pursue Medicare as being a requirement for getting OHP. Is that something that is a provision during the pandemic, or is that a longer term change? Janelle, are you able to speak to that?
That is a permanent change. It's and someone went ahead or Christy went ahead and put in
I see
a
that
written
now.
response. But yeah, it's the federal Centers for Medicaid and Medicare Services have changed the rule permanently for this. I couldn't give you a rundown of exactly the reason for their decision, but yeah, it is not pandemic specific.
Okay, thank you. All right. Well, I believe we've gotten to all of our questions. So I'm going to stall for a moment to see if any more come in, or to see if Jessica or Janelle or Christy see any additional ones that we have missed, and say that we have a whole host of webinars that cover more details about long-term care, about Medicare savings programs, about OSIP-M eligibility criteria, and I will send out a follow-up for everybody who attended today with a link to all those webinars, but they are on GroupSite. They're in our training section, and you can access the slides and the recording. You can listen to the Q&A, And if you have more interest in any of those programs, that is why we record them and post them. So I really recommend you take some time to look into that. Of course, in terms of resources, we also have our monthly module series, which is a different time in the month and different topics. They're also found in our training section on group site. And hopefully you're referring to your Getting Started guide and using your colleagues as a resource, but you also have your ROCs, your regional outreach coordinators. So please consider, reaching out when you're not finding your information elsewhere. We are here to support you. We are here to make sure you have what you need to help your folks apply for and access their care and use their care. So I want to say thank you for being here today. Thank you for asking all your good questions. And we look forward to being in touch. So thanks for all the work that you do.